So today we're going to be talking about Kawasaki disease, which is also known as mucocutaneous lymph node syndrome. It's a rare inflammatory disease of the vascular system that primarily affects children under 5. It has a largely unknown cause, but studies have shown that a combination of infection, immunity, genetic factors, environmental factors, and weather patterns could be a potential cause. And its pathology occurs when an immune response from an unknown infectious trigger may affect small to medium artery and veins, and in severe cases, this inflammation may advance to the coronary arteries where it may prove fatal.
So for the clinical manifestations of Kawasaki disease, we can use a mnemonic crash and burn. Patients with Kawasaki disease exhibit conjunctivitis, which just means red eyes. Patients with Kawasaki disease may also have a rash on their body. This rash can be found on their back, on their chest, and on their abdomen, really just anywhere central on their body. Patients may also get something known as adenopathy, which is just lymph node swelling. In Kawasaki disease, the lymph nodes that are usually swollen are in the cervical neck area. We get what is called strawberry tongue, where the tongue gets bright red and very swollen with bumps on it. Patients are also noted to have what is known as desquamation of the hands and the feet. Desquamation just means peeling of the skin, and in the squamous epithelium, the cells that line the skin are falling off. You might see this peeling, and it usually starts underneath the nail beds and progresses from there. The primary symptom of Kawasaki disease is fever lasting over 5 days, and patients with at least 4 out of the 5 crash mnemonic symptoms plus a fever lasting over 5 days can be diagnosed with Kawasaki disease. And the most significant complication that we can have is coronary artery aneurysm.
Treatment options for this disease include pharmacological and surgical. Pharmacological being intravenous immunoglobulin coupled with aspirin, which is the primary intervention for this disease. And with surgery, due to giant coronary artery aneurysm complications, a thromboendarterectomy is used to remove clotted blood from the heart, and a coronary artery bypass graft is done to restore normal blood flow to the heart. Prognosis for this disease is favorable if an intervention such as IVIG therapy has been issued, but giant aneurysms that are greater than 8 millimeters in diameter may prove fatal if left untreated.